Anyway, we now have a lot of other research on this. We have the best long-term outcome study. I mentioned this yesterday, done by Martin Harrow at the University of Illinois. He followed 200 psychotic patients for 20 years. It's a naturalistic study starting in the 80s. Everybody treated with drugs in the hospital, then they're discharged, and now he just follows them at 2, 4.5, 7.5, 10, 15, and 20 years. What did he find? The recovery rate over the long term was 8 times higher for the off-medication group. They were also less anxious, much more likely to work. In fact, there was a pretty good work history for those who came off. And on the target symptom, those who were medication compliant, in the 10, 15, and 20-year follow-up, 75% were still actively psychotic. Now, they're on their drugs. How about those off medication ever since year 2? Only about 25% still have psychotic symptoms. And by the way, the time that their outcomes diverges between year 2 and 4.5, in the first 2 years, even those who've taken themselves off, say after a year, they're really still pretty troubled at the end of 2 years. There really isn't much difference. But then you see this extraordinary divergence between the two groups. And so what you're seeing there is a natural healing process, because these are people who are leaving care. It's not like they're getting supported for this. They're going against doctors' orders, and they're doing it on their own. But that's a vision that doesn't show up in the short-term studies about this long-term course and this long-term possibility of healing. So we have that study. We also now have a randomized study down in the Netherlands in which they took people who had stabilized well. Half were put on a discontinuation or tapering arm, half maintained on drug. At the end of 7 years, the recovery rate was 2 times higher here. We also now have rat studies that have looked at this dopamine supersensitivity problem, and they show that it's a crazy model, but basically, they have a way to make rats behave what they call psychotic, right? They give them a drug, it works for a while, and then they say that drug causes the very dopamine supersensitivity that you see in humans, and then the drug stops working, even though the insult remains. Or even if the insult is taken away, that causes that, like amphetamines, et cetera. In other words, they say these drugs cause a breakthrough supersensitivity. We also have MRIs now that show over time these drugs cause the brain, antipsychotics, to shrink in volumes. And as that shrinkage happens, you get increasing cognitive dysfunction, worsening negative symptoms, and some worsening psychotic symptoms. So what we actually have in science now is a pretty good story about how antipsychotics on the whole worsen the long-term course of schizophrenia, including psychotic symptoms. And just one small thing, if you look at the place in the world today that has the best outcomes for first episode psychotic patients, it's in northern Finland, in the Western world. And beginning in 1992, they adopted a program where they tried to minimize use of antipsychotics, not put people on the drugs right away. 67% of their patients had never been on antipsychotics at the end of 5 years. And at the end of 5 years, 80% of their first episode patients are asymptomatic and working and back in school. So that tells you that if you look at this science and really use it to guide your care, you can do something much better. So that's a story about antipsychotics. I can tell you, if I could tell you a story about stimulants and ADHD, they also do not produce good long-term outcomes. So what we see time and time again is drugs that increase the chronicity of the disorder, and people coming up for a biological explanation for why that is so. And finally, going back to the rise in disability numbers, one of the problems with antidepressants is they can stir manic symptoms. So you go on an antidepressant, you have a manic episode, and next thing you know, you're diagnosed with bipolar. And once you're in bipolar, you're in a much more chronic condition. Stimulants in kids can also, they have the risk of causing psychosis or mania or mood instability that gets diagnosed as bipolar. So if we look long-term at the use of these medications in the scientific literature, here's what you find. Yet there are some people who do well on them long-term, okay? But on the whole, you see that the drugs increase the chronicity. That's one problem. Decrease functioning, you'll see increasing disability rates, and they have the potential sometimes to take a person with a mild problem, like say a depressive episode, which could be due to a loss in life, et cetera, and turn them into a bipolar patient, a mood instability, which is a mood instability seen as a much more serious disorder. You get diagnosed with bipolar, and you're often put on mood stabilizers, sometimes antipsychotics, and you're in a much more sort of difficult spot. So that's the literature that you see in the book Anatomy of an Epidemic, and I hope it's very well sourced. Okay?